Hey everyone, thinking about ditching the glasses or contacts maybe,
Yeah.
and maybe you've heard about this ReLEx SMILE thing. It seems
Yeah.
like it's pretty cool, but surgery, right? So we're gonna take a deep dive today into ReLEx SMILE, and hopefully give you all the information you need to make an informed decision.
Absolutely. It's definitely something you want to research thoroughly before you make that leap.
For sure. So first off, what does ReLEx SMILE even stand for?
Well, it stands for refractive lenticule extraction, small incision lenticule extraction.
Oh wow. All right.
Okay. Yeah. But thankfully, we can just call it SMILE.
Much easier.
Yeah.
SMILE. So it's been FDA approved since 2016.
That's right.
So it's a little bit newer than LASIK, right?
Yeah, it is newer. It's gaining traction, though.
Okay, cool. So, what does it actually fix? What eye problems does it address?
So, SMILE is currently used to correct myopia, which is nearsightedness and astigmatism.
Okay. So, for those of us who maybe don't remember exactly what those are, can you kind of break that down a little bit?
Sure. So, think of your eye like a camera. The cornea is the lens. At the back of your eye is the retina, and that's where the light focuses for clear vision. Now, in myopia, either the eye itself is too long or the cornea is too curved. So the light focuses in front of the retina instead of directly on it, and that's what makes distant objects appear blurry.
Okay, so it's not hitting the right spot in the back of the eye.
Exactly.
Okay. What about astigmatism? What causes that?
Astigmatism is caused by an uneven cornea shape. So instead of being smoothly curved, it's more like a football.
Ah, okay.
And that causes the light to scatter as it enters the eye, so things look blurry at any distance.
Okay, so SMILE basically reshapes that cornea. It's
Exactly.
like a little microscopic eye sculptor.
That's a good way to put it. Yeah.
That's pretty cool.
Yeah.
And I know that studies are showing that it's working pretty well, right?
They are. Yeah, there was a study that showed 90% of patients had vision better than or equal to 20/20 after 3 years.
Wow, that's pretty impressive.
It is encouraging, but it's important to remember that long-term data is still being collected.
Right, of course.
Like any surgery, individual results can vary.
Okay, so no guarantees, but the numbers so far look pretty good.
That's right.
So why would someone choose SMILE over, say, LASIK? I mean, LASIK has been around longer, right?
Right, it has. One big draw to SMILE is that it's minimally invasive.
Okay.
And think about surgery in general. Smaller incisions usually mean faster healing and fewer complications.
Yeah, that makes sense.
And that's true for SMILE, too.
And speaking of SMILE, I know that SMILE is flap-free, right?
Yeah.
Unlike LASIK where they create that flap in the cornea,
Right.
SMILE just makes a tiny incision.
Yeah.
So that's got to be a big plus for some people, I would think.
Absolutely. Less trauma to the cornea also means a lower risk of dry eye, which is a concern for many people after laser eye surgery.
Yeah, I bet nobody wants sandpaper eyes on top of,
Right.
their new vision.
Right.
I also read that the small incision makes it good for people with thinner corneas.
That's right.
Why is that?
Well, think of it like this. A thinner sheet of paper is more likely to tear if you make a big cut in it, right? So the small incision in SMILE makes it safer for those with thinner corneas. It reduces the risk of complications.
Got it. Yeah, that's a good way to picture it.
Yeah.
So less invasive, less dry eye risk, good for thinner corneas? Sounds pretty good so far.
Yeah.
But let's talk about the actual procedure. What does it feel like? Walk me through it.
Okay, so first you'll get numbing eye drops, and a little device called a speculum is used to keep your eyelids open,
Okay.
and then a femtosecond laser comes into play.
Okay.
You can kind of imagine it like a super precise, super fast sculptor working on your cornea.
Ah, okay, a high-tech sculptor.
Mhm.
So what is this laser actually doing, though?
So this laser creates a tiny lens-shaped piece of corneal tissue called a lenticule,
Okay.
and it's the part that we need to remove to reshape your cornea. The laser then makes a small incision about 4 millimeters, and then the surgeon gently extracts the lenticule through that incision.
Wow. So the laser does all of that
It does.
in just 10 to 15 minutes per eye.
Yes, that's right.
That's crazy. That seems so fast.
It is. It's really amazing. And the actual laser time is only about 30 seconds.
30 seconds.
Yeah,
Wow, technology has come a long way.
it really has. Yeah.
So 30 seconds, and you're done with this laser show.
Yeah.
So what happens after that? What's the recovery like?
So you'll have hazy vision initially, but that's normal, and it usually clears up pretty quickly. You might be able to drive the next day, but you definitely want to listen to your doctor's instructions.
Okay.
The main thing is to avoid eye strain for a few days.
So that means no scrolling through social media for hours on end.
All right, limit the screen time, the reading, anything that really makes your eyes work hard.
Okay, rest those peepers. So this all sounds great, but who is SMILE actually right for?
Right.
Is it a good fit for everyone?
Well, there are some guidelines. Ideally, you're over 21, your prescription has been stable for at least 2 years, and you're seeking to correct myopia or astigmatism.
Okay, so no spontaneous smile makeover for my 16-year-old who's tired of glasses.
Not quite yet. And there are certain cases where Smile might not be the best choice. So, for example, if you have certain eye conditions, or if you're pregnant, or if you're taking certain medications, that might slow healing.
Got it. So it's really important to chat with your eye doctor.
Absolutely.
They'll be able to look at your individual situation
Right.
and make sure that Smile is a safe and effective option for you.
Exactly. They're your best resource for personalized advice and guidance.
Perfect. So we know who it's for. What about the aftercare? What are the key things to keep in mind after the procedure?
So rest is really crucial. Your eyes have just gone through a procedure.
Yeah.
Even though it's minimally invasive,
Right.
they need time to heal. So
Yeah.
avoid screens reading bright lights for a few days.
Okay, so put those screens away, let those eyes chill.
Exactly. And you'll also need to use your prescribed eye drops diligently.
Okay,
These help prevent infection and promote healing, so don't skip those.
got it. Eye drops are my new best friend. What else? Anything else?
Avoid rubbing your eyes,
Oh, yeah.
no matter how tempting it is. And hold off on the eye makeup and creams for at least 15 days, just to minimize the risk of infection.
Okay,
Yeah.
no rubbing, no makeup. Got it.
Yeah.
But let's be honest. All surgeries have risks.
Yeah.
What are the potential downsides to Smile?
So while Smile is considered to be very safe,
Okay.
there are some common side effects that can include temporary inflammation glare or halos around lights and some debris where the lenticule was removed.
All right.
But these usually subside pretty quickly.
Okay, so just some temporary discomfort.
Yeah.
What about dry eye? We talked about Smile having a lower risk of dry eye, but can it still happen?
It can, but studies suggest it's less frequent with Smile than with LASIK.
Okay.
And that's because fewer corneal nerves are affected during Smile, and those nerves play a role in tear production.
Got it. So less dry eye. That's good news.
Yeah.
Let's talk about the financial stuff. How much does Smile usually cost?
So typically it ranges between $2,000 and $3,000 per eye,
Okay.
which is comparable to LASIK.
Okay.
And most insurance doesn't cover it, unfortunately.
Right. It's considered elective.
Right. But it's always worth checking,
Yeah, you never know.
just in case.
Okay. So last but not least, how does Smile stack up against the more familiar LASIK?
Okay.
What are the key similarities and differences?
Well, they both aim for vision correction, and they're both minimally invasive, but there are some key distinctions. So first, Smile is currently only FDA approved for myopia and astigmatism,
Okay.
whereas LASIK can also treat hyperopia or farsightedness.
Okay. So if you're farsighted, LASIK might be the way to go for now.
Right.
What else sets them apart?
So the technology is different. Smile relies solely on the femtosecond laser, while LASIK uses both a femtosecond and an excimer laser.
Okay. Different laser. But what does that actually mean for the patient? What does that look like?
So the big difference is the corneal flap. LASIK creates a flap, while Smile just uses that tiny 4mm incision we talked about.
Okay. So less invasive, faster healing, fewer post-op restrictions.
Exactly.
It's like comparing keyhole surgery to a more traditional approach.
Right. With LASIK, there's more concern about activities that could potentially dislodge the flap.
So no diving into the pool right after LASIK.
Right.
Got it.
Yeah.
So with Smile, you have a little bit more freedom to resume activities sooner.
You do. But LASIK has been around for much longer.
Right.
And with more long-term data available, many surgeons prefer LASIK until we have more experience with Smile.
Okay. Yeah, that makes sense. It's always a balance
Right.
between the potential benefits and then the unknown.
Exactly. But the early data on Smile is really encouraging.
That's good.
It's definitely a procedure to watch.
All right. So we've covered the basics of Smile, what it is, how it works, who it's for, and how it compares to LASIK.
Yep.
But what about the bigger picture? What does the future hold for vision correction?
Ooh, good question.
What kind of crazy innovations are scientists cooking up out there?
Well,
Well, we just explored what Smile's all about. But now I'm kind of curious about the future. What's on the horizon for vision correction? What kind of crazy innovations are scientists cooking up?
well, imagine this. Instead of just reshaping the cornea, we could be replacing damaged ones with bioengineered tissue grown in a lab.
Hold on, bioengineered corneas. That sounds like science fiction.
It does, but it's becoming reality. Think about it. Conditions like keratoconus, where the cornea thins and bulges, or severe scarring could have a whole new solution.
So it's not just about vision correction anymore. It's about actually rebuilding the eye itself.
Exactly. And it's still early days, but the results so far are really promising. Imagine the possibilities for people who were previously told that their vision couldn't be improved.
That's incredible. Okay, so bioengineered corneas are mind-blowing. What else is in the pipeline?
Get this gene therapy for eyesight.
Whoa.
Scientists are working on identifying the genes that cause myopia and astigmatism, and the goal is to be able to modify those genes to prevent or even reverse these conditions.
Wait, you're saying we could potentially nip these problems in the bud, like at the DNA level?
That's the idea. It's a whole new way of thinking about vision correction, addressing the root cause instead of
Huh.
just managing the symptoms.
That's wild. So I'm picturing a future where kids don't even need glasses or contacts.
It's a fascinating possibility. Gene therapy is still in its early stages for vision, but the research is moving fast. Who knows what the future holds?
It sounds like the trend is moving towards more personalized, less invasive solutions.
Yeah.
That's exciting.
Absolutely. Imagine treatments tailored to your unique genetic makeup and your specific vision needs.
Wow.
It's all about finding the best possible solution for each individual.
It's empowering to think we'll have so many options in the future. But let's be real. With every new technology, there are challenges and considerations. What are some of the things we need to be mindful of as these advancements develop?
You're right, we can't just get swept up in the excitement. Safety and efficacy are paramount. We need rigorous testing and long-term studies to ensure that these new treatments are both effective and safe for patients.
And what about accessibility?
Yeah.
We need to make sure that these cutting-edge treatments are available to everyone, not just a select few.
Absolutely. Equity and accessibility are crucial. We need to consider the cost, the availability, and the ethical implications to ensure that everyone benefits from these advancements.
So it's not just about the science. It's about responsible development and distribution.
Mhm.
It's a complex landscape, but an important conversation to have.
I couldn't agree more. Open dialogue, careful consideration, and a commitment to ethical principles are essential as we navigate this new frontier in vision correction.
Well said. So we've talked about SMILE, the present, and the exciting future of vision correction. But let's bring it back to our listener who's considering SMILE right now. What are some key takeaways for them?
Well, it's great to be excited about the future, but it's crucial to make decisions based on the best available information today. And that starts with a conversation with a qualified eye doctor.
Right. No amount of internet research can replace a personalized consultation with an expert who understands your individual needs and can answer your specific questions.
Exactly. They can help you weigh the pros and cons of SMILE and determine if it's the right fit for your lifestyle and your vision goals.
It's all about making informed choices. And even if SMILE isn't the right choice for you right now, the landscape of vision correction is constantly evolving.
Keep an eye on those advancements we discussed. Who knows what incredible options will be available in the near future?
It's an exciting time to be thinking about vision correction. We've covered a lot of ground today, from the nuts and bolts of SMILE to the mind-blowing possibilities on the horizon. But before we wrap up, we have a few more practical tips and resources for our listener. Stay tuned. Welcome back. So we've covered a lot of ground in our deep dive into ReLEx SMILE, from the nitty-gritty details to that mind-blowing future of vision correction.
It's exciting stuff.
Yeah, it is. So let's wrap things up with some final thoughts and practical advice for our listeners out there who are ready to ditch those glasses or contacts for good.
Absolutely.
So let's say you've done your research, you've talked to your eye doctor, you're feeling good about SMILE. It's decision time. What happens next?
Well, your eye doctor will guide you through all the preoperative preparations. This might include tweaking your contact lens wear or temporarily stopping certain medications or arranging transportation to and from the procedure.
Okay, so it's not just showing up on the day of surgery.
Right.
There's some prep work involved.
There is, yeah. Your doctor will give you specific instructions, so be sure to listen carefully.
Got it. Follow the doctor's orders. So let's talk about the recovery period. What can our listener expect after the procedure?
So most people experience some hazy vision immediately after SMILE, but it usually clears up pretty quickly.
Okay.
You might even be driving the next day.
Wow.
But again, follow your doctor's instructions. They know best.
Huh. So no driving off into the sunset with blurry vision, safety first.
Exactly.
What else should our listener keep in mind during recovery?
Those prescribed eye drops are your new best friend.
Okay.
Use them exactly as directed to prevent infection and keep those eyes happy and healing.
Right. No skimping on the eye drops. What about everyday things like reading or looking at a screen?
It's best to limit those activities for a few days. Your eyes need a break to recover.
Yeah.
Avoid screens as much as possible. Take breaks from reading, dim the bright lights.
So basically a good excuse to unplug and relax for a bit?
Exactly.
Sounds like a win-win.
Right.
What about follow-up appointments? Are those really necessary?
Absolutely. Those checkups are crucial
Okay.
for monitoring your healing progress.
Uh,
Your doctor will make sure everything is on track and address any questions or concerns that you have.
it's like having a personal eye coach throughout the whole process.
Exactly. They're there to guide you every step of the way.
I like that.
Okay.
Okay, so I know we briefly discussed the cost of SMILE,
Uh-huh.
but it's worth revisiting because it is a big consideration.
Yeah.
We mentioned that it typically falls between $2,000 and $3,000 per eye,
Right.
which is comparable to LASIK.
Yes.
But is it ever covered by insurance?
Unfortunately, most insurance plans consider SMILE an elective procedure. So coverage is rare,
Okay.
but it's always worth checking with your provider.
Yeah, you never know.
Some plans offer partial coverage or they have financing options available.
Good point. It never hurts to ask. And I know a lot of eye surgery centers offer their own financing plans as well.
That's right. So don't let the upfront cost deter you from exploring SMILE. There might be options to make it more manageable.
Well said.
Huh.
So to sum it all up, if you're tired of glasses or contacts and you're considering ReLEx SMILE, take these steps. Do your homework, research the procedure, and schedule a consultation with a qualified eye doctor.
Ask all your questions, address your concerns, and make sure you feel comfortable and confident with your decision.
Remember, it's your vision, and you deserve the best possible care. And while SMILE is a fantastic option, it's just one piece of the ever-evolving puzzle of vision correction.
Keep an eye out for those groundbreaking advancements we talked about.
Right.
The future of vision is bright with more possibilities emerging all the time.
That's right. It's an exciting time to be exploring options for clearer, sharper vision. Thanks for joining us for this deep dive into ReLEx SMILE. We hope you feel empowered and informed.
Knowledge is power, especially when it comes to your health. Until next time, keep learning and keep exploring.